Today we're diving into cancer nursing, one of the broadest and most important areas of practice you'll encounter. Cancer isn't just one disease, it's a whole group of disorders. Different causes, different treatments, different outcomes. And here's the tricky part. Cancer can show up in any organ system, which means caring for patients with cancer overlaps with almost every nursing specialty you can think of. You'll see cancer care across all age groups and in just about every setting. Acute care hospitals, outpatient clinics, rehab centers, physician offices, long-term care, and even in patients' homes. Because of this, oncology nurses wear many hats. The scope is huge, from prevention and screening all the way to end-of-life care. Now, one of the most exciting areas in oncology is precision medicine. What does that mean? Well, thanks to breakthroughs like human genome sequencing, cellular assays, and computer systems that can analyze huge databases, we can now identify unique characteristics of an individual's cancer. The goal of precision medicine is not just to treat, but also to prevent and even cure cancers. Think of it as moving from a one-size-fits-all approach to a customized treatment plan for every patient. Let's talk about epidemiology. Cancer remains a common health problem worldwide. In the United States alone, back in 2019, more than 1.7 million new cases were expected, with over 600,000 deaths. Despite all the progress we've made, cancer is still the second leading cause of death in the U.S. For men, the leading cancer deaths come from lung, prostate, and colorectal cancers. For women, it's lung, breast, and colorectal cancers. Most cases happen in older adults. In fact, 80% of diagnoses are in people aged 55 or older. Interestingly, the incidence overall is slightly higher in women than men. Now, cancer doesn't affect all groups equally. We use the term cancer health disparities to describe differences in things like incidence, screening, stage at diagnosis, and survival rates among different populations. These disparities are influenced by a mix of socioeconomic status, cultural factors, diet, stress, biology, and even the environment. For example, cancer death rates remain substantially higher in non-Hispanic Black men and women compared to other racial and ethnic groups. On the other hand, Hispanic and Latino Americans overall have a lower incidence of cancer, but they face higher rates of certain infection-related cancers like liver cancer. Geography also matters. In states with high tobacco use like Kentucky, you'll see more lung cancer than in states like Utah, where smoking is less common. And in areas with bigger socioeconomic gaps, cancer incidence and death rates are higher. A clear example is Appalachian, Ohio, where lung, colon, rectal, and cervical cancer rates are much higher than in more affluent regions of the state. So what does all this mean for us as nurses? It means we're not just treating a disease. We're treating people in the context of their environment, their resources, and their community. Understanding these disparities helps us advocate for prevention, early detection, and equitable care for every patient we meet.